Yes, Madam Chair. The first speaker for the bill is Ashley Apple.
Good afternoon, Madam Chair and committee members. My name is Ashley Apple, and I'm representing the Virginia Nurses Association. I'm a family nurse practitioner. I'm grateful for the opportunity to speak on behalf of over 110,000 registered nurses in the Commonwealth of Virginia. I just want to quickly share some facts with you. The Virginia Department of Health currently reports 20,380 COVID-19 cases among healthcare workers, and only 230 individuals have been able to successfully prove they contracted COVID-19 on the job and were awarded workers' compensation benefits. So just slightly more than 1%. The current system is not working. We know through CDC data and other published studies that healthcare professionals are at least 3 times more likely to contract COVID on the job than in their communities, and they're at increased risk for severe illness and hospitalization, likely due to cumulative exposures during the course of caring for COVID patients. Nurses are at greatest risk because they spend more face-to-face time with their patients than other healthcare providers. There's a reason that healthcare providers are being prioritized for COVID vaccines. The public, national, and local policy leaders recognize the great risk that they face in working with COVID patients day after day, as well as the risk to the general public when healthcare providers are unable to work due to COVID infection. Now, while we anticipate that the vaccine will protect many healthcare providers in the future, at a 94 to 95% efficacy rate, it will not protect all healthcare providers or those who are unable to take the vaccine because of certain health conditions. Indeed, the supply chain of personal protective equipment has improved, but it's still strained, and many healthcare personnel are continuing to reuse equipment intended for single use only. As of December, 17 states have taken action to extend workers' comp coverage to include COVID-19 as a work-related illness, and many more are taking up similar proposals as legislatures convene in 2021. Virginia's healthcare providers are at least as entitled to workers' comp presumption as those in other states. We sought to narrow House Bill 1985 by providing start and stop dates for COVID-related workers' comp coverage. So March 12th, 2020, when the governor declared a public health emergency, through December 2021. We've also limited the workers' comp presumption to those healthcare providers who work directly with COVID patients. And just very quickly, I'd like to add the voice of 2 registered nurses in Virginia who've contracted COVID-19 on the job. The first says, a month after contracting the virus, I'm still fighting pneumonia and other serious complications related to COVID-19. I have medical bills piling up and no idea when I will physically be strong enough to return to work. Workers' compensation would cover my medical expenses and lost wages, yet under the current laws, I cannot claim it without proving a direct link to a specific positive patient. I ask that those of us who have bravely served the Commonwealth during this scary and vulnerable time be cared for during our personal time of need. And the second nurse says, I'm a registered nurse working on the front lines of this pandemic. I did contract COVID-19 earlier this year as a result of caring for COVID positive patients at the bedside in an acute hospital setting. I was out of work from April 2nd to August 2nd, 2020 as a result of my illness and recovery from COVID-19. I was compensated for only the first 2 weeks, which was financially devastating for me and my family, and workers' compensation would have helped us significantly. Last week, President Biden held a memorial to honor those nurses who've lost their lives to COVID-19. We ask you to honor all Virginia nurses and healthcare providers, living or deceased, who've dedicated their lives to the well-being of all Virginians. Thank you.
Thank you so much. Noor?